All right, in today's Health Watch, it says a disturbing new study published by the Journal of the American Medical Association is showing that heart attack patients are not following doctors' orders when it comes to taking important medications that could prevent another heart attack. Our medical expert, Dr. Kevin Campbell, joins us live here, and you're talking about statins, or drugs that help lower your cholesterol and triglycerides, right?
That's exactly right. You know, these are such important drugs because one of the biggest risk factors for heart attack is having high cholesterol. And we know from really numerous studies that these drugs called statins actually prolong life in patients with heart disease. These drugs, along with other things you need to do, such as, diet and exercise, can actually help reduce the amount of plaque or blockages in your heart arteries and really reduce your risk for future events. It's so important.
So what exactly is this study showing us?
In this study, and again, it was published in JAMA, looked at the records of almost 30,000 Medicare patients who were 66 to 75 who were hospitalized with a heart attack and had filled a prescription for a statin. They found that 6 months after the heart attack, only 60% of them were still taking their medicine. Incredible. And when it got to 2 years, only 40% were taking it as directed. Many took lower dosages. Some, like 1 in 5, stopped taking the pills entirely. So, this is really the wrong thing to do.
Why, though? That's my big question. Why are they not taking these medications? They're not that expensive, and there really are relatively few side effects, right?
That's exactly right. I think there's a lot of reasons out there, after a heart attack where you wouldn't take it. I have to think of cost still may play a role. Side effects are there, but you can work through them with your doctor. And maybe just a lack of understanding of why that medicine is so important, for me would be top of the list. As we all know, a heart attack can really change your life. And the best way to avoid another heart attack is to change your lifestyle. Modify risk factors, including cholesterol. You got to take your medicines, such as statins, so that you know that these things are going to work to help prolong life in patients with heart disease. In addition, you've got to engage with a cardiologist. Work as a team to reduce your risk and, improve your overall cardiac health. It's just like we say all the time on this show.
And that's the advice from the heart doctor, so it doesn't get any better than that. All right, if you'd like to learn more about this topic or you have another health-related question for Dr. Campbell, you can find it right there on our website, WNCN.com. Thanks.